let's take a moment to talk about the hip. Now, the hip, as far as I'm concerned, is one of the most important, if not the most important joint in the whole body, because it's the link between your lower body and your upper body, between your legs and your trunk. And it's well supported with substantial muscles, smaller muscles, lots and lots of nerves, a great blood supply, and the opportunity, when it hurts, to make life really, really tough. When you have hip pain, it can be hard to do something as simple as lay down on your side to sleep. It may get in the way of you trying to stand up out of a chair or get out of your car. It may make it tough to get on the trails like this and explore nature. I mean, hip pain really can manifest itself in so many different ways, such that if you were to go to your doc and say, "Doc, my hip hurts," well, your doc isn't going to ask a lot of extra questions because you're not going to get a lot of time with him or her. And instead, your doc's going to say, "Okay, I want you to do these 2 stretches, take these medications, and come back to me in a month if it still hurts. And if it does, I'm going to inject you. We're going to put some cortisone in there. That'll make it all better. And in the meantime, head on over to radiology, get an x-ray, so that way we know exactly what's going on." And I'm sorry to say this, but the x-ray it's going to be a picture. It's going to be a hip selfie. It's not necessarily going to tell you, aha, here's what's going on. It's just another piece of data that should be used amongst greater number and volume of questions about you, about your hip, about your symptoms, about what's hurting, why you think it's hurting. How long ago did it start? Has it been happening for a long time? What makes it worse? What makes it better? What have you tried doing in regard to different exercises, different activities? How have you had to change things? What's it getting in the way of? Are you having problems getting up and down off the floor, on and off the toilet, in and out of the car, sleeping? Are you having some issues maybe playing with your kids or keeping up with your grandkids? I mean, the hip can get in the way of so many different things. And it may show itself actually as groin pain. It may show itself as back pain, leading you potentially down a whole other route where what you're doing right now isn't actually solving your problem. And so you're on this just revolving door of doctor's offices, medications, injections, more radiology for your hip for your back, because you're complaining about your back when it actually may be your hip. So it's important when you are actually trying to get a handle on your hip to talk to somebody like me, a doctor of physical therapy, who can actually assess a holistic understanding of you and who you are from head to toe. Because if the hip's not working, there's something going on in the back, there's probably something going on in the knees and the feet and the ankles. And in order for you to be able to keep doing what you want and need to be able to do, we need to understand not just what's going on in the hip, but understand what's going on broadly. We need to understand your ecosystem, so that way it's not just 2 stretches and some painkillers to say, go ahead, you're on your own. It's actually saying, okay, here's what we know about you. We've taken this last 30 to 45 minutes to really understand who you are, to look at how you move, to see what you do really well, and to see what your body and your hip are not letting you do very well. To see if there is anything else throwing your hip for a loop. And based on that, you get a few very specific exercises and very specific activities that actually start to get you moving and feeling better, because we didn't just treat the symptom. We didn't just treat the pain. We treated the reason why it hurts in the first place. Maybe something wasn't moving well, or something was sprained or strained, and that's what we're working on. And then as a result, the exercises and activities that you do help your pain feel better, helps you get back out on the trail again, helps you go out for a walk, keep up with the grandkids, get in and out of the car, get on and off the toilet, or even sleep more comfortably. So before you come and see me, what I'm gonna offer you here is I'm gonna give you 2 or 3 very specific exercises that you can try that aren't necessarily generic. Because what these are gonna do is these specific exercises, they're going to ensure that your joint is moving a little bit better, that your muscles are more active and helping support your hip and your back. And it's going to improve the link, the subconscious link between your brain and your hips, to ensure that that subconscious communication link is happening, so it's not just a big uncomfortable ball of joint and muscles and discomfort. You have a more coordinated system to help you move better and feel better, so that way when we get started, you've got a jump start on being able to get everything done that you want and need to be able to do without having to deal with the painkillers, without having to deal with the revolving door getting in and out of the doctor's office, not having to get all this extra imaging, and especially avoiding injections. And the last thing we want is surgery. Give these a try.